Don't turn a blind eye. Colorectal cancer warning signs. Colorectal cancer, also known as bowel cancer or colon cancer, is the third most commonly diagnosed cancer worldwide. It develops in the colon or rectum, which are parts of the large intestine. Colorectal cancer can affect both men and women of all ages, although it is more common in individuals aged 50 and above. However, with increased awareness, early detection, and advancements in treatment options, the mortality rate for colorectal cancer has significantly decreased over the years. In this article, we will discuss the importance of prevention, early detection, and available treatment options for colorectal cancer. Prevention. Maintain a healthy lifestyle. Adopt a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Limit the consumption of red and processed meats, as they have been associated with an increased risk of colorectal cancer. Minimize the intake of sugary drinks and processed foods. Incorporate regular physical activity into your routine. Quit smoking and limit alcohol consumption. Smoking increases the risk of developing colorectal cancer, as well as other types of cancer. Limit alcohol consumption, as excessive intake has been linked to an increased risk of colorectal cancer. Screenings and genetic testing. Undergo regular screenings for colorectal cancer, especially if you are above the age of 50 or if you have a family history of the disease. Genetic testing can help identify individuals with a higher risk of developing colorectal cancer, allowing for tailored preventive measures. Early detection. Recognizing symptoms. Be aware of the signs and symptoms of colorectal cancer, which may include changes in bowel habits, rectal bleeding, unexplained weight loss, fatigue, and abdominal pain. Consult a healthcare professional if you experience persistent or concerning symptoms. Screening tests. Common screening tests for colorectal cancer include colonoscopy, sigmoidoscopy, and fecal occult blood tests, FOBT. These tests can detect precancerous polyps or early-stage cancer, increasing the chances of successful treatment. Treatment. Surgical intervention. Surgery is the primary treatment for colorectal cancer and involves removing the cancerous tissue and nearby lymph nodes. The type of surgery performed depends on the stage and location of the cancer. Radiation therapy. Radiation therapy uses high-energy beams to kill cancer cells or shrink tumors before surgery, or to destroy remaining cancer cells after surgery. It can also help alleviate symptoms in advanced cases. Chemotherapy. Chemotherapy involves using drugs to kill cancer cells. It can be administered before or after surgery, or as the primary treatment for advanced cases. Targeted therapy and immunotherapy. Targeted therapy drugs and immunotherapy harness the body's immune system to identify and destroy cancer cells. These treatments may be used in specific cases, depending on the molecular characteristics of the tumor. Risk factors. Age. The risk of developing colorectal cancer increases with age, with the majority of cases occurring in individuals over 50 years old. Family history. Having a close relative, parent or sibling, with colorectal cancer increases the risk. Personal history. Individuals who have previously had colorectal cancer or certain types of polyps are at a higher risk. Inflammatory bowel disease. Conditions such as ulcerative colitis and Crohn's disease increase the risk of developing colorectal cancer. Genetic syndromes. Hereditary conditions like Lynch syndrome and familial adenomatous polyposis, FAP, predispose individuals to colorectal cancer. Lifestyle factors. Sedentary lifestyle, obesity, a diet high in processed foods and low in fiber, smoking, and excessive alcohol consumption can contribute to an increased risk. Symptoms. Changes in bowel habits, persistent diarrhea or constipation or a noticeable change in stool consistency may be signs of colorectal cancer. Rectal bleeding. Blood in the stool or rectal bleeding can indicate the presence of tumors in the colon or rectum. Abdominal discomfort, cramps, gas, pain, or a feeling of fullness in the abdomen can be associated with colorectal cancer. Weakness and fatigue. Unexplained fatigue, weakness, or a general feeling of malaise may occur in advanced stages of the disease. Unexplained weight loss. Significant and unintentional weight loss may be a symptom of advanced colorectal cancer. Diagnostic procedures. Colonoscopy, a procedure where a flexible tube with a camera is inserted into the rectum and colon to examine the lining and detect abnormalities or polyps. Sigmoidoscopy, similar to a colonoscopy but focuses on the lower part of the colon. Fecal occult blood test, FOBT, a test to detect hidden blood in the stool, which may indicate the presence of colorectal cancer or polyps. Imaging tests, CT scans, MRI scans, or PET scans may be used to determine the extent and spread of the cancer. Stages of colorectal cancer. Stage 0, cancer is confined to the innermost lining of the colon or rectum. Stage I, cancer has grown into the deeper layers of the colon or rectum but has not spread beyond the wall. Stage 2, cancer has grown through the wall of the colon or rectum but has not reached nearby lymph nodes. Stage 3, cancer has spread to nearby lymph nodes but not to distant organs. Stage 4, cancer has metastasized to distant organs, such as the liver, lungs, or other sites. Treatment advances. Minimally invasive surgery. Techniques such as laparoscopic and robotic-assisted surgeries offer smaller incisions, reduced pain, and faster recovery. Precision medicine. Genetic testing helps identify specific genetic mutations in tumors, allowing for targeted therapies tailored to individual patients. Immunotherapy. Certain types of colorectal cancer may respond to immunotherapy drugs that boost the immune system's ability to fight cancer cells. Clinical trials. Participation in clinical trials can provide access to innovative treatments and contribute to advancing colorectal cancer research. Remember, early detection through regular screenings, understanding risk factors, and adopting a healthy lifestyle are crucial in reducing the burden of colorectal cancer. If you have concerns or fall into high-risk categories, it is important to consult with a healthcare professional for personalized advice and guidance. Colorectal cancer is a significant health concern, but with increased awareness of prevention strategies, early detection through regular screenings, and advancements in treatment options, the prognosis for colorectal cancer has improved. By adopting a healthy lifestyle, undergoing regular screenings, and seeking prompt medical attention for concerning symptoms, individuals can significantly reduce their risk of developing colorectal cancer or increase their chances of successful treatment if diagnosed. It is essential to spread awareness about colorectal cancer to ensure that more lives are saved through prevention, early detection, and effective treatment strategies.